Good morning. Thank you, everybody, for joining us today. My name is Carter Ross. I'm with DC Villages, and we're glad to have you here for our first community conversation of 2025. Pleased to have Mark Gottlieb, principal for the Gottlieb Insurance Advisory, here to talk about long-term care planning, which is something that I know can be on the minds of a lot of folk. Mark is going to be able to give us a good look at what we need to know before we hopefully have to deal with any of it. So thank you very much. Oh, and if you would please, if you can put what village you're a part of in the chat. If you're a member of a DC village, we'd like to be able to have an idea of how many people are coming from where in the district for today. So thank you, Mark. I'll hand things over to you.
All right. Thank you very much. Appreciate it. Thank you for sponsoring this event and look forward to imparting some wisdom here on people. It's a subject that I think a lot of people are interested in learning about, but may not know some of the details. Try to look at long-term care planning, not only from an insurance point of view, but kind of a more holistic approach. Just real quickly, in terms of my background, I've been in the insurance industry for quite a number of years, focused on the mature market with things such as long-term care, Medicare, life insurance, final expense, and annuities. I was in the healthcare profession for a number of years before that, including as an administrator of a 150-bed senior living community. So I've kind of been on both sides of the fence, represent multiple insurance companies and a wide array of products, both for long-term care and others. And I do a lot of speaking around the DC metropolitan area, and I'm on the speakers faculty on both the Montgomery County and Osher Lifelong Learning Institutes. Have also done some presentations for the Alzheimer's Associations. That's a little about myself. So we'll jump right into the question here of what do we need to know about long-term care? First and biggest question is there a need for care? Am I going to need care? Generally, all of the professional organizations will cite the statistic of 70% of those 65 and over will need some type of long-term care at some point. As you see in the parentheses below, it's the types and levels of care that are hard to plan for. How much care will I need? Am I going to need 6 months and maybe I can pay for that out of my own assets? Am I going to need 5 years or more? Impossible for any of us to know that answer, which makes it such a challenging subject. So you talk about the 70% of those 65 and over, it's estimated that about 80% will be getting informal care. Informal meaning from community resources, from their own families, from their own loved ones. The other 20% will end up using what we call formal care. That means care that you're going to have to pay for, either from a home care agency, a assisted living community, an adult daycare center, nursing home, etc. Biggest issue, although the need is obvious if you read the statistics, is a tremendous amount of denial and a lack of understanding about the subject and some bad thoughts that have come along the way. A couple of people here and there might have had issues with the insurance company paying out the care that they had paid for. And so that word may spread among the community, among a family member. Yeah, I paid for long-term care insurance for all these years. Then they denied my claim. So certainly one of the issues that I'll talk about later on is you need to select a plan and a company that's very reputable. But in any case, the issue of need, there are family issues, community resources. This is a list of things we're going to be talking about today. A tremendous amount of community resources for long-term care at this point in time. It's quite a growth industry. One thing we should know about the costs of long-term care: Medicare, contrary to popular belief, does not pay for long-term care. The most you're going to get from Medicare is up to 100 days. And that's typically when you're talking about going to a rehab or a skilled nursing facility. Your Medicare A will pay for up to 100 days. In some cases, it even involves copays, but after that, you're on your own. Resources to pay for long-term care. Again, Medicare does not pay. I'm going to show you a list of different resources a person may use when thinking about how am I going to pay for long-term care, which can be quite expensive, especially depending on the level and the length of care. Then, of course, I will talk about long-term care insurance as well. Just some facts to kind of set an overview is approximately 2/3 of the use of the benefits are by females. So that's what we're seeing in terms of claims. Uh, that certainly doesn't mean that males should think, well, there's only a 1/3 chance that I'm going to need long-term care as opposed to my female counterpart. So I don't need coverage. But the fact is, there's a greater use of females. And that may have something to do with female longevity. Females will live longer and develop more incapacities, resulting in the need for long-term care assistance. Was there a question? All right, I'll continue. Approximately 90% of the use of long-term care services attributed to those 65 plus. 10% of those under 65 will need long-term care. Again, it could be for a period of 6 months to a year. It could be ongoing long-term care. So the point is long-term care isn't only for those, or protection isn't only for those who are 75 or 80 years and above. Of the population of users, that's 70%, I was saying, of 65. 40% need 2 years or less of care. 40% need 2 to 5 years of care. 20% will use more than 5 years of care. So, which category do we fall in? Could be somewhat a luck of the draw, but do we want to plan for the best case or the worst case? It's also estimated that 50% of those 85 plus will have some level of dementia. So you can be totally healthy physically, but dementia can set in a number of cases. Alzheimer's disease is growing. As a matter of fact, there was a big article in today's Washington Post talking about a continuing rise, which was disappointing to see. We hear about all the research that's being undertaken, Alzheimer's Association efforts, and yet this latest report is showing that we have not been able to slow the growth of dementia and Alzheimer's. On the family issue side, which we all need to be thinking about if we have families, there's an emotional and psychological impact of long-term care on both the family and, of course, obviously on the person who needs the care. Desires of a person needing care. Too often families will try to do planning on behalf of their loved aged person without taking into account what is it that that person really would like or need. So it's important to make this kind of a family planning issue. At the same time, there's roles and responsibilities of family members. A lot of people you speak to say, well, if mom or dad needs care, we'll take care of them. Don't worry about it. Don't think about insurance or anything else. Well, in fact, a lot of the family members who are taking care of their loved ones, 53 million unpaid caregivers in the United States, and it has a big impact on people. Challenges of caregiving, study after study. AARP has done extensive publications about the physical and emotional challenge of caregiving. And of course, the adult children have career responsibilities, other family responsibilities. One also can't necessarily say that, hey, when I need care, my significant other, my partner, my spouse, whoever it'll be, will take care of me. We do not know what kind of situation the spouse or partner is going to be in themselves at the time that we particularly need care. And of course, there are geographic considerations. There are just not that many people with adult children living, within 10 minutes of their home. And children can be, just in the United States, could be as far as 3,000 miles away. And now, certainly, some families have members overseas as well. So it is a family issue. Community resources that you may be aware of, a lot of these resources. Again, the long-term care industry has grown dramatically. So here's a list of the kind of things that people have to think about when looking at what are my options for getting some assistance, not only direct care, but supportive care. So we go everywhere from life care managers who can help one navigate the whole long-term care spectrum. There are placement companies that can help people move from one area to another. Often people are going to sell their homes, move to an assisted living or nursing home environment. Placement companies can help you locate the appropriate place to be. A wide array of home care agencies, elder law attorneys can help you, insurance and financial advisors such as myself. Assisted living communities, pretty visible. They just keep growing in number and scope in DC and in the metropolitan area. Memory care communities for those specifically needing care because of dementia and Alzheimer's. Hospice care. And finally, supportive types of long-term care situations. Durable medical equipment's going to cost some money. Technology is increasing to help people live with long-term care issues. Home modification, transportation, etc. There's a lot to be aware of, a lot to plan for. Cost of long-term care, why do I have to worry about the possibility of long-term care and do my planning? People are always doing retirement planning, but often they do not include the possibility that long-term care may be a component, and that's serious financial planning. So you're looking at needing someone in home care, 25 at the low end to 35 an hour, 350 a day to hire a live-in. Adult daycare, probably the best deal in town, 75 to 100 and a quarter a day, typically. And, that may be best suited to someone who's living with someone else, but who can't be there all day or care for them all day. So the person will get picked up, taken to an adult daycare center or dropped off, spend the day there, come back home, as long as it's a safe and supportive environment. Assisted living options, 5,000 certainly at the low end to 10,000 a month. Prices will depend on amenities and the amount of assistance needed. Often assisted living quotes from a provider of assisted living will be based on some kind of a methodology to show how many hours of support might you need, meaning they're going to need more personal care aides to assist you with that, meaning they're going to charge you more for that assisted living stay per month. There are basically two types of assisted living environments. One is kind of like home care based. There are some operators of 5 to 8. They'll convert a home to be able to provide assisted living within it. It's home-like. Some people will like that. Then there's, of course, the larger communities that have a lot more amenities. So it really depends on a person's wishes in terms of what kind of environment they want to live in. Nursing home, you're really starting to get up there in cost. Memory care as well. Memory care, again, for dementia or Alzheimer's, could be an assisted living environment with memory care, could be a nursing home with memory care. So either way, these are serious dollars to be spent to need help for long-term care. A lot of people will say, well, I'll just self-insure. I don't want to be buying insurance, paying for insurance. So, what are some of the issues we need to think about when planning? How long might you need care? Again, as I mentioned, unfortunately, none of us really know that answer. expectations for growth of investments, for decreases in investment or for asset value. A lot of people just say, I'll use the money. If I put this much aside, it grows by X% per year for X number of years. That's the money I'll use to pay for long-term care. That's somewhat unpredictable, to be honest. You can have one big downturn in the market. It changes the perspective significantly. What age are you expecting to need long-term care, if at all? What will you do if you need it sooner? Again, using the growth of investments as an example. I'm 65, I'm going to put X number of dollars rather than buy insurance into an investment. By the time I'm 90, it's going to have grown to this much to help me pay. Well, am I going to get to 90 before I need long-term care? What happens if I have a stroke at the age of 72 when I need long-term care? So, all of these things go into planning realistically. Aware of post-tax money that will be available to pay for long-term care. A lot of people say, well, I have a 401k or IRA that I'll take the money from to pay for care. Just keep in mind that if that's post-tax, the money that you take out to pay for care is going to be significantly reduced. A lot of different financial resources and sources for paying for long-term care. Obviously, assets and income stream. I run into a lot of people who are blessed in that they have very good pensions. They have large annuities, 401ks, et cetera, et cetera. So they may indeed say, well, I don't need an insurance company to pay for any long-term care. Certainly one of the issues always is, what am I planning to do with some of those assets? Did I have plans to pass a certain amount of it over to other loved ones? And if so, that won't become reality if that money gets tapped into to pay for long-term care. There is something called personal care agreements you can reach. Say with a family member, you can use family assets to pay for a family caregiver. But instead of just doing it informally, you create a personal care agreement. That means it could possibly be used when you're doing your Medicaid spend down, if you're going to have to eventually approach Medicaid to pay for your nursing home stay. Do you have plans for selling a home? If yes, certainly the money from the sale can pay for instance, for assisted living. But if you're staying in your home, you're obviously not doing that. You may be able to use some of those assets via a reverse mortgage situation. For those who qualify at the lower income end, certainly there are some programs through Medicaid. There's also something called a Medicaid compliant annuity, where a person can reposition assets to a legal partner, or spouse. So it does not entail what's called the 5-year look back from Medicaid. So if people are just transferring money to a loved one, that's going to be counted as part of the look back. With a Medicaid compliant annuity, that's not the case. There are some Veterans Administration programs for caregivers or for veterans themselves. There's an aid and attendance program where you can get a certain amount of money for home care or for assisted living. Won't pay for it all, but it's, if you're talking about I'm taking money from A, B, and C source, that may be one of the sources you can use. Life care settlements and life insurance cash values. Life care settlements have become more popular recently. There's been more advertisements about them, but you're basically selling a life insurance policy to get some money out that you can use to pay for care. Again, you're going to be giving up some money as well. Let's say you have a life insurance policy for $100,000. You need to cash out into a life care settlement. You might get 60,000 out of it, which you could then use to pay for long-term care. Again, then you won't have life insurance that can be passed along as a, death benefit to a loved one. Then finally, of course, there's the issue of long-term care insurance.
Mark,
Yes.
I'm sorry, there are two questions that popped up in the chat, and
Oh, please.
better with dealing with them later, that's fine. But The first one was asking if there are organizations such as Iona that can help with adult daycare and other options in other parts of the country besides the DC area. She has family with long-term care needs in another state.
Yes, there are adult daycare centers throughout the country.
Okay.
Each state has a list of licensed adult daycare centers. There are other sources for getting that kinds of information as well.
Okay. And then there was also the comment that private equity seems to be gobbling up things related to seniors with, in my experience, a big deterioration in quality. My home aids agency was truly local, but now it's owned by a London-based private equity firm. Are there any comments on this? People find what they have is no longer what they bought.
Well, if we're talking about if it's the same, if the long-term care policy itself, if an insurance policy is being uh, transferred over, for instance, to another larger private equity company, what have you, they have responsibilities to deliver on that policy. That's a separate portfolio of assets that are being transferred. They have legal responsibility to pay for that. So I think that probably is what comes to mind for me with that question.
Okay. Thank you.
Any other quick questions, or shall I proceed and we'll pick them up after?
Uh, I'm not seeing any others in the chat, but people, if you want to
Okay.
continue
I
dropping.
see a lot on my chat, a lot of numbers in my chat, but we'll get to those a little bit later. And again, if anyone cares to, speak out as I'm going through this to get an immediate answer, I'm happy to field those as well. So why should you buy long-term care? Security and peace of mind, certainly, because you never know. Avoiding dependency on others. Like I say, we don't know who those others are, what their situations are going to be, what their other responsibilities are. So, you're buying long-term care insurance to protect them. There aren't others. Certainly, you're buying it to protect yourselves. Uh, Protect significant others from the stress of caregiving. I've talked about that a little with family issues. Protect your assets. Again, I have 250,000 set aside. That's going to be my long-term care pot of money if I need it. Well, what happens if I was really hoping to have those assets available to my loved one? If I need care and I drain those assets, what happens to that other person or to some of those assets I was going to pass along to, say, my adult children or grandchildren? Certainly, having a long-term care policy will assist you in making a choice, how and where care is received. There are all kinds of levels of care, as we talked about, all kinds of environments. There are certainly some environments are certainly nicer than others. It's like anything else. If you're going to pick a hotel, there are $100 hotels, there are $300 hotels. Which one would you rather be in? Which one do you have the assets to be able to stay in? In terms of being able to afford long-term care, I'll say often people will price out long-term care. The the information given will have to do with this is how much you really need given the cost of long-term care. I say hedge your bets. If something's going to cost you $6,000 a month, maybe you have the assets to pay for 3,000 of it. You only want to buy long-term care insurance for 3,000. You don't need to pay double the premium to get $6,000 worth of coverage. So we need to be realistic in terms of how much we can spend. And the other thing is a lot of times quotes are given with inflation protection. Sure, inflation protection is nice to have. I'm 70 years old. What if I need care in 15 years? The cost of care 15 years from now will be much greater. It would be great that my policy has an inflation rider in it so that the amount of coverage I buy will increase as well. But again, that may not be realistic. Once you add in the inflation protection, it becomes too expensive. And instead of just saying, I'll buy something without inflation, people will just walk away and say, this is too expensive. and I'm not going to do anything. And then again, you're left unprotected. Don't overbuy if not comfortable. People would love to have as much coverage as possible. Yeah, maybe I can pay that premium. Couple months later, they go, and I really shouldn't have committed to this. It's too much premium for me. Be realistic in terms of what you might be able to afford to buy. So getting into that, we're getting into exactly what is long-term care insurance and how does it work in a nutshell here. The need for assistance for 90 days or longer is typically how we quote what a long-term care insurance or what a long-term care episode involves. Doesn't this necessarily mean you're going to need care for the next 2 years or the next 5 years? Has to be at least 90 days or longer. They will typically not pay for some assistance in the home. For instance, if you have a knee replacement and you're going to need 60 days of assistance from a home care agency, that's not considered long-term care. Triggers for accessing the benefit: you either need assistance in performing 2 or more activities of daily living, as defined here on this slide, and or the need for assistance or supervision due to a cognitive issue. So again, I'm perfectly healthy, but I'm having trouble reasoning. I'm a danger to myself or others. I might be starting to wander. I need a supervision. The policy, therefore, that I bought based on these definitions will pay out. Long-term care insurance options, they're both traditional and hybrid options. Now, typically until the last, let's say, 7, 8 years, all the policies were pretty much traditional. You were buying straight long-term care insurance. Helpful. A lot of people in this area might have been involved with the federal government. They bought Fed LTC, strictly a traditional policy. So, that's one option. These days, probably 80% of people are buying hybrid policies. Hybrid can include hybrid life plus long-term care, or you can reposition money into an annuity, which also gives you some long-term care coverage. The base upon which you will generate premium estimates are based on your age, your health status, the benefit amount you want to buy. It's all a la carte. I can buy $100 a day. I could buy $250 a day. Obviously, the premium for a 250 a day benefit's going to be that much more expensive than the 100 a day. Benefit length. Do I want to cover myself for 2 years, for 5 years, or for more? Then there's riders, such again as shared care, 2 or more people living together who are buying a policy. They can share some of the benefits, which gives it more flexibility of use. Something called elimination or waiting periods. If you have a policy, be aware of what your elimination period is. If you're buying one, be aware of what the elimination period is going to be. So for the traditional type of insurance, the big issues are use it or lose it and future premium increases. People don't like either. So, my spouse bought me a policy. We paid premiums for a number of years. I passed. My spouse calls the insurance company and says, well, we put in all this money. Mark's now deceased. What percent am I getting back? The answer is typically none. It's a use it or lose it proposition. So you're getting the protection. You have to be aware. In some cases, you may not ever use it, but if you used it, you might have gotten a lot more benefit out of it than the amount of premiums that you've paid out. Secondly, future premium increase is something that people don't like as well. I own my policy, paying $250 a month. All of a sudden, I get a letter from a company. Sorry, because of these situations, we're going to have to increase your premium from $250 to $285 a month. I'll talk about this at the end as well, but no one likes the letter saying, hey, we're going to increase your premiums. But you have to be aware when you buy a traditional policy, it starts at 250, doesn't mean it won't go to 285, 300 at some point in time. So that those are based on traditional policies. So to overcome these objections, that's why a lot of people have switched to the hybrid type of policies because you can't face premium increases. Nor will there be use it or lose it. You're going to get that money back if it's in an annuity and you don't use the long-term care. You're going to get money back if it's a life insurance policy. You don't use that pool of money for long-term care. It becomes a life insurance policy, which offers a death benefit. So, those are some very important features. Now, a lot of the life insurance policies, they'll either be offered, well, a lot more than most will offer life insurance with a chronic illness or accelerated death benefit rider. These are nice features to have. Some of them you don't even have to pay additional for it, but be aware of how long-term care benefits are structured. That the benefits with the chronic illness or accelerated death benefit may use different formulas by which to determine how much of that pool of money you're going to get paid out for a chronic illness or long-term care. With a true long-term care rider, there are different tax IRS codes for that. They will have a very defined benefit structure. So it's safer to go with a true long-term care rider, but you may get a little bit better deal going with a chronic illness rider, which, the premiums will be less, but be aware of how the policy is structured in terms of how it's paying out. Don't automatically have an agent tell you that, yeah, this is just like having long-term care. It may not be exactly so. There are a lot of different methods of payment for these kind of policies. You have everything from monthly and annually to single pay to 10 pay, for instance. A 10 pay, you can say, I'm 65 years old, I'm 70 years old, I'd rather pay for 10 years, and then I don't have to pay rather than having to pay a premium all the way out, assuming that I live to a long life, but I'm going to have to keep paying these premiums. Is it worth it? Certainly, when you're paying 10 years worth of payments, it's going to be more for each of those 10 pays than it is if you just say, I'm going to pay out till age 95. They want to get their money more quickly and upfront. On the other hand, you want to pay more quickly and be done with the premiums at some point. You can use something called the 1035 exchange, also known as a Pension Protection Act, to reposition cash values and annuities into a long-term care rider policy. So that's one popular way that people will just say, I don't want the ongoing premiums. I'm just going to take some of this money I have in an asset, transfer it into a 10 pay. Actually, there's even a few companies now offering 15 pays, and you can do it through the 1035 exchange. Why not wait to buy? People kind of keep putting it off. I'm going to do it next year. Well, we're into now January 2025. It's time for New Year's resolutions. So risk of experience an illness or disabling event which will disqualify you from qualifying for coverage. Doesn't mean you're going to need care immediately, but there are a number of diagnoses which will disqualify you, even if at this point you don't have an issue. At some point, that issue is going to become apparent. Percent of declinations consistent with increases in age. So basically, they say that the younger or the sooner you buy, the better. When we typically don't get healthier as we age, unfortunately. Select disqualifiers. Can I get a policy at this point? Well, if you've had a stroke and a TIA, even one of each, no, you cannot. If you have certain functional incapacity, depends on the type of medications used. Certainly, if you have any kind of dementia and Alzheimer's. I've had people call me and say, I just got told by my physician that I have early onset dementia or pre-Alzheimer's. I better get a policy because clearly that's going to grow into full Alzheimer's. And the answer is, well, unfortunately, the insurance companies know that. And if there's 100% chance they're going to be paying out a benefit, that means there's probably 100% possibility or certainty that they're not going to accept your application to buy long-term care. Parkinson's disease, chronic obstructive pulmonary, congestive heart failure, multiple sclerosis, rheumatoid arthritis. So there are just things, once you got the diagnosis, you're pretty much done with buying long-term care insurance. Prices of policies increase over time as well. So again, probably for the most part, the sooner the better. Some of the companies that offer policies, there's certainly a lot more insurance companies than this, but as an example, two of the more well-known, well-used companies, Mutual of Omaha, National Guardian Life, for what we call the traditional or standalone. Some of the more well-known hybrid life and long-term care policies, Hancock and Prudential sell a policy just with face value, no inflation, which will typically make them a little more affordable than some of the big companies that are selling hybrid policies, something called Minnesota Life. They have a product, Securian. Lincoln National has a product called MoneyGuard. Nationwide has several different types of products, a little bit different features. And another company called One America. They also provide an annuity and long-term care rider. So they're a great choice if you have some money that you'd like to reposition to make sure you're going to have money for long-term care payouts. And then again, there are multiple other insurance companies who will offer the chronic illness accelerated death benefits. So that's just a sample. Those are the main companies that I work with. Now, for those who already own a policy, we're almost done here, so I think we're moving along nicely time-wise. Typically, in any of these presentations, I'll have a number of people who have already bought long-term care insurance a number of years ago, but they may not even remember or be aware of what the components of their policy are. So you want to make sure before you need it. It's always nice to know what a person has, whether it be medical insurance, types of Medicare coverage or long-term care. What type of home care are they covering? Are they going to be covering only activities of daily living, or are they going to be willing to pay for assistance with your IADLs, instrumental activities of daily living? Grocery shopping, meal preparation, money management, etc. So, who can deliver the care? What your elimination periods are. Types of home care is an example. A lot of policies that were written 15 or 20 years ago, they were paying, let's say, even a few of them for informal care, meaning, well, I have this nice woman who I go to church with. She'd love to be my caregiver, even though she's informal. She doesn't work for an agency, or she's not even trained, not a nurse, not a geriatric aide, but can I use her? Yeah. Yes, that was very popular a long time ago. I think there was probably a lot of abuse or fraud, and so you typically don't see that. Now but because it is a popular feature, some of the hybrid companies are now introducing a situation where a portion of your coverage can be provided by an informal caregiver, not just by a family member, though. So you need to understand, do you need a full certified state licensed home care agency? Do you need a person who just has training in providing care and perhaps is a nurse who can offer home care assistance, or informal care? Elimination periods basically mean how long you're going to have to wait before they begin to pay out, also known as a waiting period. People who bought policies a number of years ago, typically there were 30-day waiting periods, which, well, I have to wait a whole month. Yeah, well, frankly, given the increasing cost of long-term care insurance, most policies are now issued, or at least the initial projection of cost, based on a 90-day elimination period. And that may, in most cases, mean you need to pay for the first 90 days of your care before that company will then start paying for care. You have to show them that you've paid out. Could just be for an hour of care a day. It doesn't have to be a full day of care, but you have to show some evidence that, those number of days were paid for by you before the insurance will kick in. There are some policies now, I will say. I know this is labeled for those who already own a policy, but a lot of the newer policies are offering a 0-day elimination period for home care and adult daycare. So you buy that policy, it's going to be a 90-day elimination period if you're going into assisted living or nursing home. But if you're at home, you can get care paid for by that company on day one. So it's a beautiful rider to have. I highly recommend those. It's a good thing to know. You got to know your triggers. The documentation is going to be necessary to show you truly need assistance with two or more activities of daily living. When it comes to dementia, Alzheimer's, sometimes, the cognitive abilities, there may be some cognitive tests involved. And I think that's where some of the misconceptions come about getting, paid out by the insurance company, or some denials of coverage, and people think they've been ripped off. But I mean, look at your outline of coverage. Does it spell out how they are going to determine, whether you are truly in need for those characteristics to be able to start paying? How has the policy increased in value? I bought the policy 15, 20 years ago. It was, at that time, I bought $100 or $150 a day of care. Well, now I'm close to needing to use it. So is that how much I really have? Or based on my inflation type, I may have a lot more. Okay, so a lot of people years ago bought 5% compound inflation. There are a number of different inflation types. The most popular was compound inflation. Your value would double in the 15th year of you having the policy. So if I bought 100 a day of benefit, it's 15 years later, I have 5% compound. That policy is now worth $200 a day to pay for care. Be aware of that. It's very important for going into your planning. How does the amount of coverage fit with your plans and needs? Well, the premium's been going up. If it was a traditional plan, it's getting a little steep for me. Well, but maybe there are other reasons why I can drop a little of that coverage, lower the premium, which is now increased, because other assets and income might have grown more than I thought they would. If you're facing premium increases, it's the last one. And, this is quite popular. Again, if you bought a traditional policy, you get that dreaded letter, 3 years later, 4 years later, in most cases, not all. But in any case, you have to wait. You get the letter. We're planning to increase your premium by X dollars. You can either pay the increase, just tell us yes, and we'll start deducting more, or you want your premium to stay the same. We can keep it at the level you bought it at, but here are the compromises. We're either going to decrease the days of care or years of care that this policy is going to cover you for. So you're giving up, a certain amount of care in order to keep your premium the same. Same in terms of the daily benefit. I bought, $150 a day. It's 15 years later. It's now worth $300 a day. But if I say I don't want my premium increased, they're going to take that $300 and back it down to 250 or some such level. Or alter the type of inflation protection. My value of my policy has been growing by 5% compound for the last 15 or 20 years. I now have a lot more money in. I don't want to pay any more in premium. I can back my 5% compound inflation rider down to 5% simple, which means it's going to grow a little slower, down to 3% compound or other options. So, your policy amount has built up. From here on in, it's going to grow a little bit slower, but hopefully by now it has a nice base amount. And to me, that's probably the best of the options, frankly. There's also a buyout option, which to me is pretty well unreasonable. So that's my presentation. This is the information about how to contact me. If you'd like more information, article, research documents, advice, no fees, no obligation. Only way I make a living is if I sell a policy and get paid a commission by whichever company the policy was placed with. Other than that, I try to freely give of my time and knowledge to help people figure out where they're at with all of this and what to do. I'm happy to make presentations, certainly upon request, if there are a number of villages and some of the heads of the village, the boards of the village would be interested in having me make this kind of presentation to your constituents. Always delighted to do that. So given that, I don't know if you want me to go back or forward or what have you.
Mark, there was a question you'd mentioned about some policies or cost services being tax deductible and others taxable. And there was a question if you could please say a little bit more about what's taxable and what's deductible. And the person said they didn't quite follow what you were saying about IRS obligations.
Oh, well, basically on that, what I was just saying, well, there's two subjects here. One was I was talking about IRA or 401k, and I was saying you take that money out, that grew without taxes to a certain point. So now if you're going to take that money out, it's going to be worth less to you because a certain amount of it now has to go to pay the taxes that you never paid. So I don't know if that was the IRA or 401k. In terms of the IRS, well, and I didn't really even mention this, the IRS has certain amounts that if money's coming out of a long-term care insurance policy up to a certain amount, it's non-taxable. Okay, so the proceeds from a long-term care policy are non-taxable up to a point. Most people never get beyond that point where it becomes any taxable money. So I'll leave it at that. Hopefully that answers the person's question.
Hopefully, if anybody wants to unmute themselves and ask a question directly, please feel free. Or you can put a question in the chat and I'm happy to read it out if you'd rather not speak on screen.
Third option, if I may jump in here, is simply to take down my email address and my telephone number. Feel free to come at me sometime after this presentation. Could be later today or in a month or 2 months from now, but feel free to reach out. I'll try and share any information or thoughts I have, at that point in time.
And I'll just throw that info into the chat as well, which may make it easier for you to take it down if you want. You can always hit the save chat button to be able to save it or take a screenshot. Does anyone have any other questions that you'd like to ask Mark?
I have one, although it's not exactly on the topic. You can decide. You made a reference to the Medicare. This, I think, for nursing homes, 100,000.
No, I said 100 days, not 100,000.
I mean, 100 days. Yeah, I take it back 100 days.
No
Anyway,
problem.
isn't there, I never quite understood. I think they have some kind of a reset provision that if then, let's say you use 60 days and then you don't use it for a year or two, you go back to zero or something like that.
You're talking about long-term care policies?
No, I'm talking about the Medicare nursing home coverage.
There's nothing about going back. It's basic. Medicare is basically an annual, benefit.
Okay.
So I don't know, so you're in a nursing home 100 days and now you need further care. Well, now you're on your own. That's what I'm saying. Now, if you have a new episode the next year, you're going back to a nursing home, you may well be able to get up to 100 days again through Medicare.
Okay. Thank you.
You're welcome.
Does anyone else have any other questions or long-term care or related topic that Mark might be able to address?
Happy to answer Medicare questions as well. If you want to email me or give me a call, I know there are often a number of questions on Medicare regulations and, Medicare policies that one may have, whether they're supplement advantage plans, prescription drug plans, etc.
I am not seeing other questions, so you've covered it all for us, Mark. Thank you so
All right.
much. That's awesome.
And in less than an hour, which was a good accomplishment, I think.
Well, thank you so much. And we will be putting this up on DC Village's YouTube channel so people can go back, refer to it. And if you save the chat, you'll have Mark's contact information. It's been copied over into that as well. So thank you so much for joining us today for DC Village's community conversation. And we will be sharing information about future such programs as soon as we have them all ready to go. So thank you, everyone. Thank you very much, Mark. And
My pleasure. Thank
everybody has
you.
a wonderful day.